Good evening. We are here with another Eye Care for Your Brain. This is me, Dr. Karen Sullivan. I'm a board certified neuropsychologist, and we have been together for almost 2 years now. One of the very best parts of doing these live feeds every week is getting to hear back from all of you who have been such faithful listeners and learners with us, how this information has impacted you. The very best thing that we can hear is that you have less pain and suffering because of the information that we share here. I truly believe that knowledge is power, and one of the biggest problems we have facing the brain health community these days is a lack of access to high quality information. There are so many people that we see that come through our doors here in our practice in North Carolina that seek us out because we really pride ourselves on being good educators, good information givers. And I had the idea a few years ago that I really wanted to extend that reach and connect with more of you around the world, and that's what we've been doing. So what we're going to do tonight are talk about 4 of the brain health community partners that we have met in our journey. And it's very important to me that you know about these people, because if you like what we are here doing, you will really, really like what they are doing, because the vision and the heart and the skill is very similar to what we are trying to bring to the table here. Really, these are people or groups who really share the dream for moving the needle forward on progressive, humane brain health care. I'll be doing part 2 of this presentation next week, so I do have some more folks that I want to introduce you to, but for today, we're going to talk about 3 different people or groups whose mission I really, really respect, really closely matches ours at Eye Care for Your Brain, and I want you to know that you can count on these people for truthful, genuine brain health information and resources. So the very first one is a very special guy. We sometimes think of him as everyone's sweetheart. People claim him as their online boyfriend, but he is taken in real life. This is Joe from the Neuro Nerds. If you guys know who Joe is, I'd love to have a little comment from you to let me know that you know about this amazing guy already. So how I got to know Joe from the Neuro Nerds is back in October when we were getting ready to release our stroke recovery guide. I really wanted to make sure we had the maximum reach in the social media community for getting the word out. And as you know, we've mostly been on the platform of Facebook. So a few people mentioned to me, you should really expand into Instagram. So I go over to Instagram, we set up a page, and I'm starting to search the hashtags of stroke survivor, stroke thriver, and this guy keeps coming up over and over and over again. He's got this huge smile, he's got this very bright face, he's looking right into your soul through the Instagram camera, and I realize this is someone who's very well connected in the stroke community as kind of the hub of resources and support. And sure enough, this is Joe from the Neuro Nerds. So I send him a message, he writes back right away, and basically I send him a copy of the guide, and we start to talk about me being on the podcast for Neuro Nerds, which sure enough, this is exactly what wound up happening. So episode number 65, I'm going to be posting links as I'm talking and afterwards so you can have access to these people. But we did a great podcast together. It was my very first podcast. It was very special to me. But basically within 5 seconds of our first conversation, we were basically just kind of off and running. Joe, he's live with us right here. And there's some things I want you to know about Joe. Some things I'm telling Joe about himself is that Joe is basically the man. Joe is the epitome of a true advocate. Joe had a major catastrophic hemorrhagic stroke in his 30s. He had a shunt put in to reduce the blood in his brain. Joe has been public about being highly traumatized, not just by the actual stroke, but something that also happened to him when he was in the hospital. And he's been a real crusader for this idea that post-traumatic stress disorder can go along with stroke, which of course is very true, but something that has not gotten a lot of press. Therefore, not a lot of people feel validated if they feel that way and don't have access to good resources. So what does Joe decide to do with these really horrific human experiences that he has had? Well, he decides to dedicate his life to building a community of young stroke survivors. And one of his goals is to change the face of stroke. And this is very important because many of us have a stereotype in our head that strokes happen to older people, people who have gray hair, people who wear glasses, people who have wrinkles, right? Joe spends almost every day, if literally not every day, connecting with stroke survivors from all over the world. And he is really a point of comfort and contact and education for so many people. And the guy was literally born to do this. You talk to him and you just get this unbelievable, positive, wonderful, loving feeling like everything's going to be okay in the world. And because of his own personal experience, he's in a very unique position to do this. And I say this all the time, as much as I care as a neuropsychologist, the truth is in this moment in time, I have not experienced a stroke. And there is something unique and healing that can only happen between survivors. Joe is this dependable source of support for so many people. He really is, I know this to be true, a ray of sunshine when people are struggling, despite the fact that he has his own active recovery, his own trauma that he's working on. He is really full circle in that trauma spectrum where he is using his experience to decrease the suffering of other people. And I really can't think of anything more admirable than that. Joe comes with two very lovely, beautiful partners in life. His lovely girlfriend, Felice, is a producer of their podcast. She also happens to be in Kanye West's Sunday Service Choir. And he has a very pretty therapy dog named Stella. So what you can do to support Joe and make sure that we do everything we can as a community to support this guy who supports a lot of other people is to go on their webpage, theneuronerds.com, be a Patreon supporter if you can. Listen to the podcast that they put out. Follow them on Instagram. Go onto their Facebook page. They have about 102 episodes in the can for NeuroNerds, and they span all the most important issues. His co-host, Lauren, who I've not had the pleasure of meeting, she really represents the concussion traumatic brain injury community, and she seems absolutely wonderful as well. So between the two of them, they are there for you to give you high quality information and really that survivor's perspective. So we love you, Joe, and truly are so grateful for everything that you bring to the community. The second person that I want to tell you about is Healing the Brain with Jane. Jane Connelly is an occupational therapist. She is based in Santa Barbara, California. Occupational therapy is one of my most beloved specialties in the brain health world because it's very similar to neuropsychology. It's really where science and clinical care meet in a very practical way. So what OTs try to do is very similar to what we do as neuropsychologists in that we scan the research literature to get educated, but it's all through the funnel of how can this practically apply to my patients and their recovery. So she's the queen of, life hacks, trying to find practical, low-cost, free ways of doing things. She had a very similar professional path as me, wherein that she became very observant of the status quo in the brain health industry and basically, very similar to this one, didn't like what she found and kind of jumped ship to start her own thing, which is really a brave thing to do when you're very used to things like, a salary and, healthcare benefits. To go out and try to make your own way is not easy, but it is truly noble because when you're the boss, you get to design brain health outreach the way it truly should be done. So Jane and I have both been down this road, so we have a lot of support and connection in that sense. We too were also very instant friends when we talked on the phone for the first time a few months ago. We have a very similar orientation, really seeing our patients as experts in the room. We're not here as a provider and the person is here. We are all experts, and it's by joining together that we're actually going to get somewhere. We really look to our people as teachers, right? They are the first-hand accounts of what they're going through, and I am out here on the outside trying to understand better. It's very important to both of us to be on top of the very best quality information, but also to try to find a way to bring it to people in an accessible format. That is a very, very strong strength of Jane's. She has her own private practice in the beautiful Santa Barbara, California area, and she has a brand new podcast called No Brainer. And on Friday, I am going to record my episode of No Brainer, so I'm super psyched to that. She is very interested in dispelling brain health myths on her podcast and spreading the word about recovery tips and tricks. So many of you out there, I know, are struggling with a lack of information. You don't have insurance benefits, your benefits have run out, but yet you still know you have more recovery to gain. You are so lucky to be living in this day and age where you can go on Facebook, you can go on YouTube, these free platforms, and to be able to watch a video from Jane showing you how to work on getting fine motor skills back, learning how to work more successfully with an iPhone. It's really an amazing time to be in recovery, because just imagine the people 10, 15 years ago that didn't have anything like this. So I am very, very proud to be Jane's friend, and y'all can follow her on Facebook. She's a big one on Instagram. One of the things I love most about Jane's public image is she is known for using some of the most beautiful artwork in her posts. I'm a big fan of aesthetically beautiful things, and she always just seems to have the very best message, and there's just a real beauty to the way that her posts are put together. So please follow her on social media. I think you will really like her. The next people we have is Stroke Camp. Stroke Camp is such a cool thing. They are an awesome organization. They are all about helping survivors and caregivers improve their quality of life as people, not just people who are living post-stroke, right? That is something we have to work to fix. If we just put people in this very narrow box after a stroke, after a brain injury, once they have dementia, we are missing an opportunity to see them in all their complexity. They don't stop being a person with a variety of interests and human needs just because they have a stroke, right? No duh. So what Stroke Camp is a 3-day weekend retreat that focuses on, imagine this, relaxing, having fun, entertaining, laughing, hanging out with people who can really understand. It is something that was started in September 2001 when a very special woman named Mara Lee, her husband had a stroke, her husband John, and he couldn't speak, he couldn't walk, he had trouble understanding what was going on. And they, for 2 years, went to stroke support groups and desperately were trying to weave together a tapestry of healing all on their own, like so many of you. And Mara Lee tells a story of reading an article about a camp for stroke survivors who were having trouble speaking, and she had an epiphany that maybe she too could bring this to her community and it would benefit her husband and the local stroke support group she was a part of. So it started in 2004 with one retreat where people came from all over the place to them. And in 2007, they actually started a nonprofit, and the whole idea was to then allow them to bring Stroke Camp to the people. So they have done amazing work on the individual level of survivors and caregivers. They do a lot of work on the earliest warning signs of stroke, because we now know that time is brain, right? And it's critical to make sure we're not just focusing on the most common impacts of strokes, the stereotypes we have about, half the face drooping, trouble speaking, your arm not working. It's very important we talk about the balance symptoms, the vision symptoms, and that we really get people to urgent care as soon as possible. They've done some really cool things with the baseball community, minor league and major league initiatives called Strikeout Stroke in 2009, where they're really trying to get the word out, especially to younger folks, about what to look for in the case of a stroke. They have held over 100 camps. How cool is that? I am right now trying to wrap my head around what it would take to offer one of these in my community, because I believe so much in their vision. How it works is they get support from local sponsors, so places like hospitals, stroke centers, rehab centers, drug companies, tech companies, and basically they provide a donation in order to sponsor the stroke in their community. The people attending the stroke are asked to pay about $125, but there are scholarships available if that's not possible. Financial distress is definitely a largely unspoken about stressor that comes along with having a brain health challenge, so they appreciate that. The registration form for each retreat is listed on their website, which we're also going to post here. And they have programs in a lot of communities across America. So if it's not necessarily close to you, chances are there's going to be one in your state offered soon. So what I love about Stroke Camp is that they are really focused on reviving the self after a stroke. They want people to embrace life again. Yes, it may be different than it was before, but please do not allow your recovery to become medicalized. We can't have every outing that we do involve stroke recovery in this very narrow medical sense, right? We want to make sure that people are still doing things that make them truly joyful and laugh and socialize and be together. I was so pleased when I was able to get Marilee's response to our stroke recovery guide. She truly made our day when she wrote to us, and she said some very nice things. And that really started a conversation about how we could join forces to really move stroke care ahead. And fast forward, their associate director, a camp director who's a big part of Stroke Camp, came here to Pinehurst, North Carolina, where I live, and we went out to dinner. He was coming to the state to give a grand rounds in Wilmington, but we were able to coerce him to come and have dinner with us. And when he was here, he picked up 300 of our stroke recovery guides for Stroke Camp. How cool is that? That is the whole reason that we spent so long making that recovery guide, is because we want it in the hands of people. So anyone that can help me get it to people who need it, they are very, very special to us. So their website is strokecamp.org. You can send them an email at info@strokecamp.org. Look at all these hearts I'm getting here. That's just so cool. So you can get on their newsletter. The Stroke Recovery Guide was featured in it recently, very kindly of them. And basically you can just start to get alerts. I know, Joe, right? You can start to get alerts if they're doing something by you. They also have an awesome Facebook page. Okay, so last but not least by any stretch of the imagination, our final brain health community partner we're going to talk about today are the good people at the nonprofit Stroke Forward. Stroke Forward is the product that came after a truly important and very, very well done book called Identity Theft. This is the story of a Stanford University professor named Dr. Deborah Meyerson and her journey to recover after she had her stroke. Now, what is so awesome is that this is giving us a first-person account of her experience in her recovery. But what is so important to know is that this is a social scientist, a woman who studied identity at an elite academic medical level. She brings so much insight to this topic, and then she's got this subjective experience coming together. So it makes for an unbelievably powerful, powerful book. So what it's really focusing on is how she successfully navigated all the different barriers. And there's a wonderful focus on emotional recovery, how it is that we redefine ourself after key pieces of ourself have changed. How do other people react to us, and how does that affect our sense of who we are? This is the future of stroke care. If we don't start to talk about the emotional things, the psychological impact, trauma, how it affects our relationships, how it affects our highest level of emotional health, like identity, we are missing the boat, and we're leaving too much suffering on the table. And that is what collectively, the four people I've shared with you tonight, we all have this in common. So what I want you to know, what I want you to be very hopeful about, is that we're talking, we're getting on phone calls, we're emailing, we're private messaging each other, we are plotting and planning, and we're inspired. But we need you all to reach out and support us. Let us know that you want this. Let us know that you believe in this and that you want us to put our minds together and to try to really get this thing going. So Deb Meyerson, Dr. Meyerson, and her husband Steve were the ones who created Stroke Forward. So this is the nonprofit arm that got started by their book. Last week, I had the pleasure of speaking with a woman named Jody, who is the executive director of Stroke Forward. And it was kind of unbelievable how many points of connection we had, personally, professionally, really just unbelievably aligned in terms of wanting to be a part of innovative care, of actually doing things, not just having the idea or the desire, but actually committing to projects that took a lot of time, a lot of blood, sweat, and tears, but that are out, that are tangible things that we can now get out to the public so people can feel more understood. And I think that's really the point of all the people I wanted to share with you tonight, is that when we don't talk about all the symptoms after, say, a stroke, and people don't hear their own experience, they're not going to feel validated, they're not going to feel understood. And what's the natural consequence of that? They're going to feel alone. And to feel alone is unbelievably anti-human. At the most basic level, we are social creatures who need affiliation and connection and understanding and support. And when we don't talk about trauma after stroke and we don't talk about identity changes, we're not fully validating the stroke survivor's experience, and that is not okay. We cannot allow this to be a medical discussion only. So I want you all to know about all these folks. Identity Theft, the book, Rediscovering Ourselves After Stroke, is available on Amazon. I am savoring it with such delight. That's what I do with my favorite books. I read a couple pages and then my brain gets all wild, imagining the different things I could do with that idea or how I can work with these people. And so I am savoring this book. It has 56 5-star reviews on Amazon. They have a website, identitytheftbook.org. I would be most grateful if you can go on these people's websites, send them a little message, let them know how much you appreciate what they're doing, because we thrive on positive reinforcement. We are people who want to know that our efforts are being heard by our chosen people, and that is really you, all of you out there that live with a brain health challenge. So if you think we're on the right track, please tell us. Tell me right now in these comments. I desperately want to know that you're hearing this message and that you are a part of our brain health revolution. Please share this video. It's critical to us to get more followers, able to do bigger and bolder things. Thank you guys so much. I'll be with you again next Wednesday, and I'm going to tell you about 4 more groups that have really impressed me over this last year. Thank you guys so much. And I see Joe's message here. I can't wait to talk with you soon, Joe. And it's just a wonderful thing to be a part of a community that means so much. So thank you guys so much. All those hearts are the best. And I will talk to you guys next week. Bye.